Warm greetings to my friends and colleagues. I am Dr. Aparna Sharma. I'm working as a professor in the Department of Obstetrics and Gynecology at All India Institute of Medical Sciences, New Delhi. I work in the area of maternal health and I also specialize in fetal interventions. Beyond my clinical work, I also work in the field of quality improvement in healthcare settings within the healthcare systems and resources. Today, I'm going to talk about my research project initiative, which is the SARTHaC initiative, which stands for Sensitive, Attentive, Respectful, Timely, and Humanized Care. This is an initiative for respectful maternity care. To say the least, mothers bring in the future. Let them have dignity in labor. When a child is born, a mother is born too. Let them be born safe and with respect. I would talk about this project in 4 phases. The first one being, why did I choose to do this project? I have been seriously troubled by the widespread prevalence of disrespect and abuse during childbirth, the impact that it has on the experience of care and the future health-seeking behavior. There is enough evidence to say that there is widespread prevalence of disrespect and abuse globally. The woman's experience in labor room can either empower them or inflict a lasting damage and emotional trauma. We as healthcare providers really need to choose what we want that experience to be. The universal rights of childbearing women have been laid out very clearly. The categories of disrespect have been divided into 7 categories, which are widely well defined and well known. Now, with this background of the need and the clarity to do this project, I moved on to the next phase where I realized that I needed a lot of help to do this. I know I'm very passionate about this, but I needed to involve more like-minded people. The next thing would also be to develop the related content. All of this would, of course, require funding. And then there was the question of dissemination. To make all of this possible, I had the support of very wonderful people. And I would like to acknowledge the team, Dr. Manjupuri from Lady Harding, Dr. Seema Handu from Pronto International, Dr. Ram Chahar from WHO India, and Dr. Asmita Rathore from AOGD. Now, when you have the support of such a great team, you do get energized to take the next step. And with that, I moved on to the next phase, which started with an agreement between WHO India and AOGD, which committed to developing learning resources and tools, developing catalysts for change, providing a platform for dissemination, and build advocacy for incorporation into the undergraduate curriculum. Now, following this, the first training of trainer workshop was done in December 2022. It was indeed a unique activity, first of its kind, with sessions on communication, simulation, a birth needs activity. It was a very interactive session with interprofessional interactions, bilingual messages, giving very clear messages on respectful maternal care. Doctors and nurses from 9 public hospital and private hospitals of Delhi attended the workshop with commitment to replicate the workshop in their own settings. Following this workshop, very shortly, there was another, within the same week almost, there was another workshop, this time for district hospitals of Delhi. This was like a multi-pronged approach. And this actually created interest within the Delhi government machinery, and this can go a long way in making this movement actually a revolution. This was followed by workshops in MAMC and BSA Hospital. Now, there are upcoming workshops we have a very tight schedule in DDO Hospital, Lady Harding Hospital, Burari Hospital, New Delhi. Now, without even realizing how much time has actually passed, we reached the liftoff and we started thinking about dissemination, sustenance, advocacy for widespread dissemination. We've realized that it cannot be one team, one person. So we are trying to involve the government machinery. We are involving other organizations like C3, which is a known organization which works for maternal care. And we're following the cascading model where we believe the medical colleges are going to train the nursing staff and the residents, the district hospitals are going to train the medical officers. For sustenance, it's important to include the improvement methodology. So workshop at every place ends with the beginning of a QI project where there are definite process and outcome measures. There is a time series chart which is to be developed. There are QI champions which are identified who would document challenges. PDSA cycles are to be undertaken, and the QI projects have started at least 3 places, and we are looking to understand the results and take it forward from there. Now, lastly, respect is a cultural issue, and to change the culture, we need to start early. By the end of this initiative, we not only hope to create a pool of motivated catalysts of change working towards respectful care, but also build advocacy to incorporate teaching this in the undergraduate curriculum. To conclude, I would say this leadership journey has been an incredible boost for my passion to work towards respectful care. I've had the opportunity to discuss the implementation challenges with my mentor, coach, which has been of immense help. Various peer coaching sessions have not only helped me in expanding my vision, but also looking at a problem from a different perspective. I truly believe that this journey started today is the beginning of a seminal work in the field of respectful maternal care, and the bonds made along this journey will always remain vital and contribute significantly. WomenLift engenders mindful and thoughtful leadership. Many women become leaders by default. But here is a roadmap to become a leader by design, and I'm truly grateful to be a part of the first WomenLift India cohort. Thank you very much for sparing your time.